Right. So good morning, one and all, and welcome to the Sussex Population Health Equity Fellowship information webinar for the second cohort of 2024-25. My name is George Anibaba. I work for Health Innovation Kent Surrey, Sussex. Some of you, many of you, all of you might remember or know our organization as Kent Surrey Sussex Academic Health Science Network. So we've recently undergone a name change to Health Innovation Kent Surrey Sussex, and we are absolutely delighted to be working with Sussex Health and Care on the second year of the Sussex Population Health Equity Fellowship. So it's a true real pleasure and delight to be able to work with the Sussex system on a meaningful and impactful program of work. So we've got an hour penciled in. However, we may not need to use all of that hour. Hopefully, you're not sick of the sound of me, so I'll try and work through a few items on our agenda. So if we can have the next slide, please. And by the way, I'm going to have to channel my inner Chris Whitty, so you'll hear lots of next slide, please. So a few things to cover today. So the background, so why was the fellowship set up? Who is it aimed at? And what's the structure? Some reflections from cohort one to give you a sense and a flavor of what happened in the first cohort and what to expect in year two. So we'll have some highlight sound bites and a story from one of our fellows. We'll talk through and walk through very quickly the application process, and at the very end we'll have an opportunity for questions to be asked. So for now, if you have any questions, please put them in the chat and colleagues will pick those up or pull those together. And if we can't respond to them here in this information session, we'll make sure we reach out to you and respond to those questions. And we've also got some frequently asked questions in our FAQ section at the very end. So opportunities for questions at the end for people to raise hands and ask whatever is on your mind. So our next slide, please. So kicking off with a background to the Sussex Health Equity Fellowship, the why and the purpose. Why has this been set up? So next slide, please. So you would all have seen a variant of this slide, I'm sure, or this image. And often equality and equity are conflated terms and people seem to think that they mean the same thing. And whilst there is some relatability, synergy, and a link between the two words, are slightly different. Inequality often, or equality, is to do with an objective difference in outcomes. So when we're talking about outcomes, we're thinking about mortality, morbidity, or service provision. And this is impacted by, socioeconomic factors like income, employment, where you live, and so on. And geography, rural versus urban, specific characteristics as well, your ethnicity, your gender, your religion, your sexuality, and it's to do with socially excluded groups as well. Inequity, on the other hand, is about a difference in service access. And as you can see in that image, this is about everybody wanting to watch the game, but not everybody being given the opportunity to watch the game and be a spectator. Similarly, we recognize that there is an unfair and avoidable disadvantage in our health and care systems and societally. And many of you will be familiar with the inverse care law, which suggested 30 years ago, not three, by Julia Tudor Hart in a paper for The Lancet, which described a perverse relationship between the need for healthcare and its actual utilization. So in other words, those who most need medical care are least likely to receive it, and conversely, those with the least need of healthcare tend to use health services more and more effectively. So in Sussex, we recognise that that is not right and something ought to be done about it. Next slide, please. So why a fellowship? How is that going to tackle some of those challenges? Well, taking a bit of a step back, we know that through the data that's available, that certain groups in Sussex face poorer health outcomes due to unequal access to health and care services. We know that there is a difference in life expectancy between men and women, and it also depends on where these men and women live, amongst other things. And Sussex Health and Care as a system aims and wants to and intends to create a fair, accessible, and responsive healthcare system. And also, we know as a workforce, as staff, there are increasing service demands, and these prevent staff from effectively addressing inequities because everybody's spinning multiple plates. And whilst the intention is there, the skill, capability, headspace, protected time isn't always there to do this properly. So how do we respond to that? The fellowship, whilst not a silver bullet, it is an attempt to try and address that. So in 2023, the Sussex Population Health Academy, which the fellowship is part of, was launched to boost workforce skills and help tackle health inequalities. So the constituent part of the academy, which is the Health Equity Fellowship, is an inclusive program for all Sussex ICS employees and organizations. And we'll say a bit more about that shortly. Next slide, please. Furthermore, in terms of the purpose and the reason for this, again, in the ICS strategy, and sorry for using acronyms, the Integrated Care System strategy for Sussex states, and also the shared delivery plan states three priorities. And one of those is around continuous improvement areas of focus, and addressing health inequalities is one of those. So we recognize that those exist across our population, and to achieve greater equity, we mentioned the difference between inequality or inequalities and inequity. For us to achieve greater equity in terms of the experience, access, and outcomes of our population, we need to do something about it. So that's clear in the shared delivery plan. And to answer a question that I've just seen pop up, yes, the slides will be shared after that, after this session. And this is a golden thread running through the delivery of all the actions we're taking, and health inequalities essentially has got to be everybody's business and not just for one organization or one group of people or one team to tackle or to care about. Next slide, please. So the key part, what does a fellowship look like? What does it feel like? So structurally, there are a few elements to it. Namely, you get an opportunity as a fellow to spend 1 day a week, roughly, over a period of 8 to 9 months, to focus on a project, to focus on a problem, a wicked issue you've identified and you've expressed through your expressions of interest, and work on or develop a project that will help you turn that idea into something that you can implement, something you can action, and tackle a specific health inequity in Sussex. And the expected output of that is you'll have a refined project proposal and hopefully an intervention that addresses identified health inequities. So you'll be walked through that journey from setting that up to actually implementing it. There'll be an opportunity to learn. So as well as doing the work, and that's a crucial part, there'll be an opportunity to learn as you go, and that will be in a few formats. So workshops, and these will be in person. There will be 5 of those, and we had 5 last year, and we're planning to run the same number of workshops, working through elements of equity and what that looks like. And these are structured learning opportunities on relevant topics. So again, an opportunity to gain knowledge, connect with fellows, and build up your skills relevant to addressing health inequities. In addition to that, there will be some webinars and masterclasses, which will be remote, where you get an additional opportunity to focus on a specific area and gain some expert knowledge on a topic that is relevant to helping you address inequities. And these sessions will be online, as I said. And this year, we are taking a slightly different approach. Last year, we had drop-in sessions, which were quite informal and we ran with the fellows our first cohort last year, but this time we want these to be a bit more focused, and we are introducing action learning sets and opportunities to actually deep dive and get under the skin of issues and problems and work collaboratively in solving those together. And of course, there'll be an online community for people to share resources and communicate and network between yourselves as prospective fellows. And as I said, the commitment is 1 day a week over a period of 8 to 9 months. So the fellowship will kick off in September and will end in April or into May even. Next slide, please. Now, who can apply? As we said, this is an inclusive program. Now, I think I saw a question in the chat around which region is doing this. So this is Sussex only. So this is Sussex only, and not Kent and Medway yet. We hope Kent and Medway will launch something similar, and other parts of the region in Kent, Surrey, and Sussex, for that matter. But this is for organisations in Sussex. So the 7 NHS provider partners in the Sussex Health and Care system, and primary care partners as well. That's including local authorities, so East Sussex County Council, West Sussex County Council, Brighton and Hove City Council, and of course colleagues from voluntary, community and social enterprise partners involved in providing health and care services in Sussex. So if you work for any of those organisations, and of course we cannot name all the voluntary, community and social enterprises, but they're included in that, then you or someone you know that might be interested qualify. So how are fellows selected? You'd be glad to know you haven't got several fiery hoops to jump through, but we start off with the expression of interest. So we'll share a link to that and a QR code later on. But this is about the strength of that expression of interest, including the personal motivation, why you actually want to do this, commitment to health equity, and how you intend to apply that in your place of work for the populations you serve. And in addition to the strength of the expression of interest, the quality and relevance of the proposed project as well is going to be key. So does it align with Sussex Integrated Care strategy priorities? How does a project consider and address inequalities and inequities experienced by health inclusion groups, for example, where it's applicable, asylum seekers, the homeless, sex workers, and so on. And also, fellows would be selected, providing they have confirmation of support from their host organization and specifically their line manager. So confirmation of that will be required. Next slide, please. So we're gonna not hop into a DeLorean, but we are gonna reflect and think about what happened last year. So when we ran one of these sessions last year, we didn't have reflections, but thankfully now we do. And next slide, please. So this being our inaugural fellowship, just embarrassing our first cohort here. We were pleased to have 8 fellows recruited, and the plan is to have 8 to 10 fellows maximum this year. And the beauty of this fellowship was these fellows came from various organizations across the system. So it truly felt inclusive. So a few NHS organizations, social enterprise organizations, hospice, and we would like greater variety because we know we could have greater representation across the organizations represented in the ICS, certainly with our second cohort. So we would like to encourage applications from organizations across the system because everybody has a contribution and a part to play in tackling inequities, and we want to make sure they benefit from the knowledge, skills, and opportunities on offer to do that. And next slide, please. So a few sound bites and reflections. As I mentioned, we had a combination of in-person workshops, webinars, and drop-in sessions. And here are a few sound bites describing the experience of fellows last year and largely positive, actually. Again, an opportunity to be afforded a space, the headspace to really tackle what we would say are knotty issues often, and there isn't always a linear way of addressing them, but to have a positive experience in doing that, particularly as some of the issues can be quite emotional, that requires support from your fellows and also from ourselves, supporting the fellows through that journey. So collaboration being one of those key points mentioned, building of confidence in using the knowledge and the skills that are being shared, and ultimately being able to address those barriers that you identify in terms of access and being able to make an impact in terms of outcomes. Uh, and I believe and I'm hoping that you will hear from one of our fellows um, from the last cohort who will share her experience. And I just want to check if Fern is here. Is Fern?
Hi, yes, I'm on the call. Hello.
Hello, Fern. Good to have you. So I'm not going to do any more talking. I will after you you talk us through your experience, but tell us a bit about what it was like for you as a fellow, what you worked on, and why you would recommend it to others to
Yeah,
join the fellowship.
yeah, really happy to talk to it. So the fellowship came at a ideal time where we had been working in our organisation. So I work at the Sussex MSK Partnership, so with um, physio and musculoskeletal patients across Sussex. We'd been doing some work on our data capture, and it was now that we were just starting to kind of get in the results to be able to see who our patients were and think about targeted approaches for where we needed to um, pool our resources um, and improve patients' experiences. The fellowship was all encompassing, really. So the sessions included information on health inequalities, but also on how to gather and report on data, how to work on evaluation methods and project management. So it really assisted you in your leadership and development skills in all areas beyond health inequalities as well, which is the right support to move you forward. So off the back of it, I worked on a few different things for my work-based project related to the fellowship. So we did some work connecting to the Asian network in Crawley because we could see that we weren't proportionately seeing the same amount of patients to the population within Crawley. So we did some work connecting to the community there, and the fellowship also assisted us in how to run community engagement and connect with communities. So that was really timely and important. We did some work on seeing our patients in a different way in community appointment days. And I also did some work in rolling out training and learning and development for colleagues in health inequalities. Um, and then as a part of that, we can now build and grow that work. So during the 9 months, I was able to really steer in the right direction, but that work is now continuing and is part of embedded into my role now, and so it can grow and develop. So the learning part of it, I would say, was like amazing, and it really grew my confidence in understanding where health inequalities show up. It really opened my eyes to it. I was already aware of the injustice, but it helped you see it at a different level. Um, and a lot of that was really challenging, and I felt really well supported by uh, George and the others facilitating the fellowship. And also, we were able to work on the practical steps. So, like I said, like the data analysis, the evaluation, all of those things to really bring the project together and make it valuable and embedded within our workplace and showcase to the leaders about the value of the work that we were doing. It was amazing to be able to connect to experts in different areas and to keep those connections going. And I've been able to reach out to speakers who have presented as part of the fellowship and ask for their advice on work that I'm doing now. So it's really grown what I'm able to do in the workplace and my network within health inequalities. And yeah, I feel much more confident and competent running and facilitating events and speaking to people and knowing the considerations and opening those difficult conversations, because without having those conversations we can't make progress, and it's by having them that you can lean towards a more optimistic and hopeful outcome. We can't just shy away from these things. So yeah, it's really transformed the way that I work for sure. And my role is in learning really, but I also work within projects and governance as well.
Thank
I
you so
think
much,
that's all.
Fern. And no, that's brilliant and really heartening to hear, what your experience has been like and your journey really over throughout those 9 months. And um, I guess if you were to encourage someone to apply, do you have any sort of words of advice, wisdom, um, warning even?
Yeah, I'd say it really is open to everyone. That was one of the like most valuable things from the sessions, that we had such a range of different skill sets and different roles there. So there were people working in children's care, people working in hospices, in pharmacy, in data and IT. So all of us had really different backgrounds, but that was really amazing to uh, share our experiences. And I think, yeah, so don't be put off by whatever your job role is. It's for everyone. We had commissioners and managers as well. Um, and it's it really is impactful in your workplace. So as long as you can get your workplace to support you and sign up for you, then it will make a huge difference for you and for them. It's really transformative.
Thank you so much, Fern. And that's almost pretty much a mic drop moment there. And thank you for sharing those insights. And yes, Fern has said, don't be put off by role title. It's open to anybody, regardless of what your role is, and it's all about the strength of your application and the problem that, or problems even, that you want to solve, address, tackle. Um, so what I'm going to do next is just talk you through the process. So you've heard a bit about the background and why it was set up. You've heard um, a bit about the structure and what it looks like. You've heard also about the some reflections and also Fern's experience of being a fellow. So a couple of stages to the application process. So the EOIs, or expressions of interest, the call went out on the 31st of July. So that form is now live. We are inviting, welcoming any expressions of interest, and that will end. The deadline for that is on the 2nd of September at 11:59, and you should have a link to the form in the chat, and we'll share it again later on. So, 2nd of September, that's your last chance to submit something. So you've got until then. We're mindful of summer holidays as well. There'll be a shortlisting exercise to complete by the end of that week. So the 2nd of September being the Monday, the 6th being the Friday. And we will invite those who've been shortlisted to pitch their case for becoming a fellow and tackling inequity. And then soon after, fellows will be confirmed, and then soon after that, fellows will be announced with a view to launching the fellowship um, in the same month. Now, this year compared to last year, we've had a slight delay in things, mainly because of the political environment with a big P, and elections and various other things that were um, decisions were hinging on. So thank you for bearing with us, particularly those who knew about the fellowship last year, didn't get a chance to apply, and were really looking forward to being part of it this year. So that's partly the reason for the delay. So thank you for bearing with us. And that's the process described in a nutshell. And next slide, please. So why should you apply? What's in it for you? What will you get out of it, or your organization even? We've kind of touched on this throughout this session, but you will gain some equity focused knowledge. And I know I gave that example of the difference between inequality and inequity, but it doesn't stop there. There is more to it. So you'll gain some knowledge around that. You will acquire some new skills in population health and innovation, and doing things differently. And we're quite permissive when we refer to innovation. It's not just, boxes or and wires and fancy gadgets or wireless devices. It's also about new service models, new models of care, and new ways of doing things. And you'll get an opportunity to publish health equity project on the Sussex Population Health Academy's website. You'll have an opportunity to enhance community engagement with diverse groups, and we heard from Fern's story, and you'll certainly um, hear examples from other fellows from last year about how they were able to engage more meaningfully with the communities that they serve. Improve cultural competence is actually a session specifically on that. Um, and also build your capacity, not just yours, but your host organization's capacity and skills and capability to tackle this. And over time, we hope the intention is you'll have more people who are aware, averse, confident, competent, capable, interested in tackling this and able to do so effectively. So, if you're interested in becoming a fellow, or you're not quite sure, you're skeptical, do reach out, and we'll share our contact details later on. I know Fern has offered for people to reach out to her, so thank you, Fern, for doing that. If you know someone who's considering applying or really looking to apply, you've got the QR code here. You've got the link to the form in the chat as well. Please do so. And if you're still unsure, you can read the information guide, in the link to which it's been dropped in the chat, but also is attached to the form as well. And of course, for those who've had to leave midway through this session, this has been recorded and it will be shared in due course for people to play back or for you to share with others who might be interested. And finally, so when we talk about health equity, and we've talked about a methodical way, an intentional way of doing that, we've actually got some anchoring principles. And our Chief Medical Officer, Dr. Marianne Farrow, with experience working internationally on tackling health inequalities, but also our colleagues internally, and shout out to my colleague Lucy, just to embarrass her, and also our other colleagues, Sharon and Megan from Health Innovation Care SES, in one capacity or other have had some experience of tackling health inequalities, or thinking about them, or helping people think about them. So this is all framed around our 10 core principles for health equity. So when you're thinking about health equity and we're talking about a health equity lens, that lens has 10 segments or 10 principles, and they are there on here on our screen now. Off the back of that, we recognize that people need the know-how or a guide or a toolkit to help them navigate that. So we just launched a guide or published a guide for innovators in particular. So those who are developing new solutions, new technologies for use in health and social care. So there's a guide for them. But do not worry. What about everyone else? Well, we are working on developing similar guides for commissioners and organizations and other key as needs may arise. So we recognize that this is an important tool, an important topic, important conversations to be having, and we are trying to do something about it, also in partnerships with the Sussex Health and Care through the fellowship. Um, and that is pretty much it from me. I hope that that's been useful and informative, and we've tried to cover all bases, but not um, spare any information. But of course, we recognize that there might be some questions that we may not have addressed. So this is an opportunity now for people on the call to ask any questions, and you can use the hand raising function. And someone's already, there we go. So we've got a couple of people raising hands. So I don't know who's first. Um, is it 1 second? So someone might have to help me with identifying whose hand's gone up first and if they can be unmuted.
I'm actually so hungry. Hi, should I go first? Sorry. Hi, my name is Kath. I'm the renal pharmacist from Sussex County Hospital. Just a quick question regarding the commitment that we need to take along with the fellowship. I'm currently working full time, and we mentioned that 1 day per week, and also there's a guided learning sets. Does it require any time from the work? Like, is it like, do we need to request like study days that we need to be absent or away from my usual job?
Yes, pretty much. So that 1 day typically can be spread throughout the week. So if we won't have sessions every week. So as I mentioned, there'll be 5 in-person workshops throughout the 8 to 9 months even, and a series of webinars. And because you won't have something happening every day, on the days where you've got a half-day workshop, for example, that's half of your allocated day, pretty much a whole day if you include travel and so on. But in other weeks, it's at your discretion to use that day the way you deem appropriate to help you with catching up on what you learned from a workshop, or doing some reading, or working on your project and developing that, or reaching out to me and the team for some support. You will need to get approval and support from your organization for that. And depending on your application, this the agreement between yourself and your host organization will be around flexible working arrangements to allow you to do that. And there is a small nominal amount that the system can support in terms of contribution, uh, monetary contribution, not significant amount, but that will require some matching or match funding from your organization as well, if required. Conversely, if your organization is happy to release you for a day because this fellowship aligns to a project you're already working on, then that day is already protected for you to use. Does that answer your question?
Yes, kind of. So do we have like a timetable that I can kind of like expect how to manage my time while working?
Sure. So that timetable is still a work in progress. We've got a timetable, but it will be shared post your application. However, I recognize that given the timelines, you may need to let your employers know what that might look like. So we can share some information on what that indicative schedule looks like. It's subject to change depending on a few things, but we can share an indicative schedule or timetable of activities to support your application. So if that would be useful, actually, we can share that in the next few days.
Yes, that would be amazing. Thank you so much. Thank you.
No worries. Thank you for your question. We had a hand go up and then go down. But I don't know is that Michael?
I just needed to know about the workshop deadlines as well, or dates as well, because whether or not I apply depends on whether I can make the workshop. So thank you.
Of course, yes, absolutely. I imagined that might be a question from most people, so we will share those, noting they're indicative, hoping they won't change, but we'll share those. And I think we've got, is it Michael?
Yeah, I'm here.
Hi, Michael. You've got your hand up. You've got a question.
Yes. You have to excuse the kind of question I'm going to ask. It may not be appropriate. I'm hearing a lot about the functionality of the training, but not as to who the training is aimed at. I'm thinking here particularly, I'm a retired person. I work voluntarily. What would I come away from having? Is there some sort of qualification? That's usually what training is about, isn't it?
No, good question. So, we, as well as a certificate and a recognition from the Sussex Health and Care system, we are trying to finalize still the CPD accreditation for our fellows, our first cohort, and our prospective fellows, and that normally takes some time to be released. But that's one thing you get, and as well as that, there are expected learning outcomes for each of the sessions that we run, and that detail is provided. Once you're onboarded or successful, you will have sight of what those expected learning outcomes are. So as you attend a session, what are you expected to be able to do or learn or know even as a result of attending a workshop or a webinar or masterclass or an action learning set? In terms of who the audience is and who it's aimed at, it's people who are employed or work for the organizations in the Sussex Health and Care system that we listed earlier, and many of which are not listed, particularly if they're social enterprise or part of the voluntary third sector. So as long as you work for one of those organizations and your application meets the criteria and is strong enough, then consequently those sessions are going to be tailored to all the participants there, all the fellows, the prospective fellows, and you will gain some skills and also recognition for it. Does that answer or attempt to answer your question, Michael?
I'm not sure it does.
Okay.
I'm active with a number of organisations which are part of Sussex NHS.
Right.
I'm thinking particularly of Isabel and the Digital Data Board, and obviously that's where overlap occurs. None of which I get paid for or have a particular clear view as to what would make it relevant to my interaction.
Sure. Well, Michael, I would be more than happy to have a conversation with you offline, and my email address will be shared at the end to discuss that and understand and try to answer your question better. So if you would welcome that, I'd be happy to get that set up. Yeah, fantastic. Thank you, Michael. Thank you for your question. I don't think I can see any other hands up unless there are, and I've missed them. Oh, I think there's one that's just popped up. Can't see a name. It says red.
Hi, sorry. That's my name. Sorry, I did write a question in the chat, but I thought I would ask it as well, because just to make sure I get an answer.
No problem.
I'm wondering if there's any kind of specific funding available to action the project that's being worked on, or whether the organisation you work for has to kind of seek funding separately in order, because obviously if we're going to do a different piece of work, that's going to come with an additional cost to action. How does that work in terms of like setting up a new kind of project or work stream? Do we need to ensure that there's funding in place beforehand, or is there a way of getting funding through this fellowship?
Sure. So in terms of protecting the time, there is an opportunity to explore funding or having a match funding arrangement where it's appropriate, but the amount is nominal, recognizing the financial constraints across the health and care system. But in terms of the projects themselves and funding discrete areas of work, there isn't funding such. And mind you, this work, it starts kind of as an idea and then turns into something that becomes implementable, and maybe the outcome or the result is having a business case or a case for change that requires funding or needs to attract funding for it to become sustainable. So this is initially aimed at people who have an issue, a recognized issue, a challenge that they want to tackle, or supported to gain the skills to do that. And also supported with tools to make it sustainable and for it to outlive their fellowship, so that once you finish your fellowship, you're able to carry on with that. So again, we mentioned the criteria, including, alignment to strategic priorities, and if it fits the bill, then there could be some support there. But in terms of your organization being funded for discrete projects, that is not something that's available, but it's more around your time being released to participate as a fellow.
Yeah, that makes sense. Thank you. And I think maybe I had am I right then in my thinking previously was that the aim of the fellowship was that you had a completed kind of project up and running by the end, but is it enough that you have a project idea and that during the fellowship you gain the skills that needed to get that up and running, and then you can kind of source the funding at the end to then implement that?
Correct. Yeah, because we
Okay,
had,
that's great.
we had some variation certainly with our first cohort, because some projects, you've got challenges outside of your control that you might have to contend with in order for a project to gather pace and be expedited or completed. And realistically, if we're talking about transformational change, within 9 months, you will not necessarily be able to do that. But this is an opportunity for you to get to the point of being able to do that and prove that you're able to do that as well, demonstrate that you're able to do that.
That's really helpful. Thank you.
No problem. Thank you, Red.
George, there's a question in the chat about where the in-person sessions will be held.
Yes, so you'll be on tenterhooks for that one. It will be in Sussex. It will be a location in Sussex. We used a number of locations. I say a number of locations, a couple of locations last year, namely in Brighton and in Crawley. So we are going to be confirming what those locations are in due course. But again, they will be in Sussex. So for those of you who live in Sussex, hopefully, transport wise, that won't be an issue. And additionally, in terms of expenses to travel to those locations, that will be included or factor in as well. So our fellows last year were able to claim back for the journeys to those locations. So our prospective fellows will be able to do the same. And again, this is, the questions were usually asked, most of which we addressed in the information session, why it's important and what's the purpose of it. We talked about the fact that we've got inequities and challenges in terms of life expectancy and health outcomes, and the fellowship intends to upskill people to be able to tackle those, and will help deliver the system ambitions, but also personal and professional ambitions of individuals that live and or work in Sussex. The structure of the fellowship, again, that was shared in a previous slide, and we shared what those components are. So as you receive this pack, as you watch the video back, that should answer the question. But as we mentioned earlier, an opportunity to work on a project, to attend workshops, online webinars, the action learning sets, and also access to an online community. And third question, if you're outside of the NHS, absolutely. As we mentioned earlier, we are keen to have applications from organizations outside of the NHS. So those are most certainly welcome, as long as they're part of the Sussex Health and Care partnership in one form or another. And the big question, which was asked earlier, will this fit into your working schedule? Whilst the workshops are mandatory and the webinars, but the workshops more so, it depends on what that looks like for you and the support of your line manager and host organization, what support they're prepared to give you. And the expected commitment is 1 day a week, but as I mentioned, you can use that flexibly. And of course, there'll be an expectation to attend the half-day mandatory sessions. The next slide, with a few more questions. Has this been done before in Sussex? Prior to the first cohort, no. So this is pioneering, dare I say. There are other parts of the country and the world that have undertaken similar fellowships, not many in the country. So this is an opportunity not to be novel for novel's sake, but to do something new and share the learning with others who are also trying to embark on a similar journey. We know that we had a question about whether or not this will be done, or this is available for people in Kent, and we're hoping that from the experience of the fellows and the outcome and the impact of the fellowship through the projects and through the learning, there will be other organizations seeking to do this as well. How many people are we looking to recruit? Between 8 to 10, depending on the strength of the applications, as we mentioned. And how the 1 day is expected to be split, we kind of answered that earlier. And is it accredited? So as well as a recognition through a certificate and the networks that you build, we are working on finalizing the CPD accreditation for fellows who complete the fellowship. So those are mostly the questions that we've been asked and have attempted to answer. Lucy, there are a few more.
Yeah, George, there's one in the chat about whether this can be a local project, I'm guessing a place, or if it has to be a Sussex-wide project.
As long as it fits with the priorities, location isn't a strict criterion. So it doesn't have to be Pan Sussex, but there should be some scalability, because the idea is about more people accessing and benefiting from things that work well. So if something is proven to have an impact, if something's proven to be beneficial in one neighborhood, in one area, then there should be an opportunity for spreading that. So as long as it can be applied broadly and spread for more people to benefit, then that strengthens the case for one's expression of interest. But no, it doesn't have to be Sussex wide. It can be focused on an area, on a discrete area in Sussex. Hope that answers the question. And finally, some contact details. So as I mentioned, I'm George Anibaba. I work for the Health Innovation Network and Surrey and Sussex, and my colleagues joining me on the call today, Sharon, who's also contactable, as well as Lucy Hooper, who you just heard speaking, and Megan Cassie. So if you do have any questions, feel free to drop us a line. You've got the link to the form. We encourage applications, of course, and this is the purpose of this session. And we encourage you to encourage others to apply as well. So we're going to give you 9 minutes of your life and time back. We scheduled this for an hour. Thank you for joining. Thank you for your questions and your interest. And we look forward to seeing either yours or colleagues' applications in due course. Have a good rest of the day. Take care.